Have you ever paused to consider, like, all the data collected by those everyday health devices you might wear? Your smartwatch, maybe a fitness tracker.
Yeah.
Where does all that data go? And, where's the line between just convenience and something that starts to feel a bit more like, well, surveillance? Today, we're doing a deep dive into some really compelling source material we found. It connects a pretty striking statement from a public figure to um, a whole series of unsettling threads. We're talking government funding, major tech players, even some surprising legislative moves.
Yeah, and our mission here really is to help you connect these dots. We're going to unpack these threads. They seem separate at first glance, maybe, and explore the specific concerns the material raises, particularly around how shifts in healthcare funding priorities might, impact your own privacy and your access to care down the line.
It's definitely a complex picture.
It is, but we'll try and lay out the full scope of what the source is discussing.
Okay, so let's unpack this. The whole thing seems to start with this vision laid out by RFK Jr. This was back on June 24th during a congressional hearing. He talked about his desire for every American wearing a wearable within 4 years. So aiming for 2029.
Right. And the material we looked at interprets that, well, maybe not just as encouraging people to buy Fitbits,
More than that.
Potentially, yeah. The source reads it as a possible federal mandate for actual biotech monitoring devices.
Wow. Okay, so if that were the case, the immediate question is money, right?
Exactly. Where would the funding come from? For 330 million people, that's not cheap. And what's really fascinating, or maybe concerning, depending on how you look at it, is where the search for that money leads in the source material. It points directly to what's been called Trump's big, beautiful bill. And digging into that, the material highlights some significant reported cuts. A 40% cut for the NIH, the National Institutes of Health,
40%.
and a 50% cut for the CDC, the Centers for Disease Control.
Half the CDC's funding.
Yeah. And the observation made right away in the source is, look, these are the agencies that actually do the medical research, the disease prevention work.
Okay, so huge cuts to traditional health agencies.
Right.
But then there's a contrast.
A very sharp contrast. Our sources point to this one specific, very large line item.
Which is?
$25 billion earmarked for something called a Rural Health Transformation Program.
$25 billion. What does that transformation actually involve, according to the material?
Well, the program description mentions remote monitoring, so continuous data collection, right?
Right.
Robotics, potentially for automating care, and artificial intelligence, presumably, to analyze all that data being collected.
So very tech-focused, advanced technology.
Exactly. The material really highlights these as being key to this whole transformation idea. And this immediately flags what the source sees as a major contradiction.
How so?
Well, you're defunding the traditional research, the disease prevention, maybe even letting rural hospitals struggle or close, while pouring this massive amount of money into a tech-heavy rural health program.
So it sounds less like improving rural healthcare and more like replacing it.
That's exactly the feeling the source material conveys, that this tech program is meant to replace traditional care, not just add to it.
And the timeline you mentioned, there's something specific there, too.
Yeah, this is where it gets, like you said, really interesting. Of that $25 billion, a huge chunk, $20 billion, is specifically marked for the years 2028 and 2029.
2028 and 2029. Wait, that's the exact same time frame as RFK Jr.'s suggested deadline for everyone wearing a wearable.
Precisely. The source points out that apparent alignment in the timelines, the connections start to feel, well, less coincidental.
Okay, so the money seems earmarked for tech, lining up with the wearable timeline. Where do the tech players come in?
Right. To understand the bigger picture presented here, you have to look at who operates where tech meets government power. Peter Thiel comes up immediately.
And his company, Palantir.
Exactly. Palantir is described in the material pretty bluntly as a surveillance company that builds spy tools for the government.
Okay, a surveillance tech company.
And then, get this, Palantir just landed a massive contract, $443 million.
With who?
With CDC.
The same CDC that the material says is getting its funding cut by 50%.
The very same one.
So, what's the interpretation there?
The source suggests this could be seen as Palantir basically stepping in to take over the CDC's data functions, especially if the public agency itself is being, dismantled or significantly weakened.
Wow. Okay. And the material often links Thiel with another big name in tech, right?
It does. It often assumes a very close connection between Peter Thiel and Elon Musk. Sometimes uses phrases like thick as thieves, though that's just the source's language.
So Thiel's company potentially handling health data, and then the conversation shifts to Musk.
Naturally, yeah. It shifts to Elon Musk and his company, Neuralink.
Neuralink, that's the brain chip company.
That's the one.
And there have been some recent developments there, haven't there?
Very significant ones, highlighted by the source. Back in January, the University of Miami was chosen. It's the second U.S. site for Neuralink's human brain implant trials.
Okay, University of Miami.
And even more recently, like just 2 days before the source video was made, one of their first human brain chip surgeries was reportedly completed.
Right. Now, we should be really clear here. The source acknowledges this too. The University of Miami has a very strong, legitimate reputation in brain research, helping paralyzed patients, things like that.
Absolutely. On the surface, it's a respected research institution, makes sense for these kinds of trials, given their expertise.
But Neuralink's own mission, it goes further.
Well, if you look at their website, as the source did, their stated mission goes beyond just helping current patients. The goal mentioned is symbiosis with artificial intelligence.
Symbiosis with AI. That's a much broader, maybe more ambitious goal.
It certainly sounds like it, doesn't it? And the source material also raises some pretty serious concerns about Musk's methods getting there.
Saw it.
Citing reports, it mentions 1,500 animal deaths at Neuralink facilities since 2018. Failed experiments, basically.
1,500.
Yeah. And it also points to reports from employees complaining about intense pressure from Musk, his whole move fast and break things philosophy, but applied to, living beings in this case.
Okay, so Neuralink, Miami, ambitious goals, but also these concerns, which leads to the question.
Why Florida? Why specifically Florida for these trials? I mean, there are lots of top neuroscience programs elsewhere in the U.S.
Right. What did the source find when looking into Florida?
Well, the deep dive looked at the legislative environment there under Governor Ron DeSantis, and something pretty specific stood out.
Yeah.
On May 30th, according to the analysis, DeSantis vetoed a bill. This bill would have allowed families to sue doctors for medical malpractice if that malpractice resulted in a death.
He vetoed that, allowing families to sue for wrongful death in malpractice cases.
That's what the source material states, yes.
Right.
The veto of that specific bill. And broadening out from that specific veto, the material paints a picture of Florida under DeSantis' leadership. It uses the term experimental playground.
Experimental playground. What does that mean in this context?
It suggests an environment where, reportedly, emergency powers might be used to bypass normal oversight, where controversial programs get tested out, where legal boundaries might be pushed more easily.
So the question the source poses is, does this create a kind of environment for, say, experimental medical procedures where there might be minimal legal consequences if something goes wrong?
Exactly. A place where you could potentially test things that, as the source puts it, wouldn't fly in any other state.
So connecting the dots here, the suggestion is that Florida's specific legal and political climate might be seen as advantageous for human trials of something like Neuralink.
That seems to be the implication drawn in the material we examined, yes. Wondering if the state's policies create a unique, maybe less constrained space for this kind of experimentation.
Okay. Now, there's another detail the source uncovered that adds, well, another layer to this. A proximity check.
A chilling detail, really. The author checked the distance
Between the University of Miami Neuralink's trial site
and a detention center, one referred to in the source as Alligator Alcatraz, where it says thousands of people are held, reportedly against their will.
and the distance.
45 miles.
Roughly.
45 miles apart.
Close enough to make you pause, certainly.
Yeah.
Amplifies that what-if question, doesn't it?
So the analysis then asks that question directly. Is there a connection?
Yeah, the what-if. But it's crucial to note the material is careful not to directly implicate the University of Miami itself.
Right. It acknowledges their legitimate research history.
And also notes that Musk reportedly uses his own surgeons for these Neuralink procedures, not necessarily university staff surgeons.
Okay. But the broader concern remains.
The overarching concern, yeah, the one the material keeps coming back to, is this. Look, when you defund agencies like NIH and CDC, when rural hospitals potentially close, who suffers? It's always the most vulnerable, right?
Yeah.
Poor communities lose access.
Exactly. Poor people lose that crucial access to healthcare first.
And this leads to a really provocative suggestion from the source material.
A very provocative one. It basically outlines a potential strategy. If you wanted to control those communities, or maybe enable predictive police surveillance.
How would you do it?
Well, one way suggested is, first, you dismantle their existing traditional healthcare systems. You take away their access.
Okay.
And then you come back and offer surveillance technology disguised as healthcare as the only option left. You make them dependent on the very tech that monitors them.
Wow. Surveillance disguises healthcare.
And there's that ticking clock again, remember? The biotech, whatever it is, needs to be ready soon. By 2028, 2029, perhaps?
Which means?
Which means you need a lot of human test subjects. Fast. You need volunteers. Or, as the source darkly suggests, maybe you find a group of detained immigrants who maybe can't consent, can't sue, can't speak out.
That's deeply disturbing.
It is. And the source material concludes that whole section by invoking history.
With that final question.
Yeah. A chilling historical parallel, it just asks. What was the name of that other place that performed criminal medical experiments on prisoners?
Leaves you thinking, doesn't it? So let's just recap. We've traced a really complex picture today based on the connections drawn in the source material we explored. Started with ambitious ideas about wearables, tracked potential funding shifts away from traditional health agencies towards tech,
Brought in major tech players like Thiel and Musk, Palantir and Neuralink, and their government contracts or controversial trials.
looked at a specific legislative environment in Florida.
And ended with these really disturbing questions about vulnerability, control, and potential test subjects. It's a lot. And just to reiterate, this deep dive was really about exploring the perspective and the connections laid out in the source material provided. Our aim was to help you understand the specific concerns and the dots it was connecting between technology, policy, and power.
It definitely paints a picture. So maybe the thought to leave everyone with is this. As technology races ahead, faster and faster, and information itself becomes this incredibly valuable currency, how careful, how vigilant do we all need to be? Especially telling the difference between genuine care and something that could be potential control, particularly when it comes to the most vulnerable people in our society. What stands out most to you from everything we've covered today?